So how do we do shared leadership well? Well, then now enters team dynamics. When you think about uh, how you interact with others, and when you are working together to achieve a goal, the idea is, does this collection of individuals share in that goal? So as a professor in the School of Medicine, I am motivated by what my school, my dean, my dean rewards me on. Now, if I collaborate with a faculty member in the School of Arts, it is very probable that the reward system for the School of Arts is very different than the School of Medicine. Now, it doesn't mean that we don't have a shared goal in whatever reason we came together. We came together because we want to build a program to improve patient care. But we do each other have to keep in mind of the potential conflict that each of our individual level goals may have on that shared goal. So I think thinking about that in terms of your team, and engaging in communication for getting this out on the table, if you will, helps to improve the team dynamics. So interdependence of members. This is a key aspect of teamwork. If we are not interdependent, we are not a team. We are a collection of people. We could be in my mind, I'm imagining the I Love Lucy conveyor belt. We are that. We are a people around a conveyor belt where I do something to something and pass it off, and then I don't see it anymore. Without interdependence, we are not a team. And when we do have interdependence, the aspect of team dynamic and how we share leadership then becomes more critical. It's understanding our independence. How am I interdependent on Justin or Chelsea or Genevieve? We're bounded by time. And by time meaning there are iterations of, or there are episodes of how we do our work and how we engage in one another. And we operate in a context. We operate in the context of, students in a classroom, and whether it's, Psych 101 or the last class that a student takes in their student years, or we're at VCU or in the School of Medicine or the School of Arts and the School of Nursing. So we operate in a social context, in a system that does have influence on how we engage as a team. Okay, so we talked a little bit about the challenges that you talked about. So I guess in my preparation for this, I was thinking about, the student perspective as to, I'm only a student, what can I do? And I think thinking about the system in which the students are working or that you're working in. So being able to say, thinking about it in the terms of the big picture, taking yourself out of it first so that you can see the interconnectedness. With the example of the medical student is, the student is learning, but they should take themselves out of it for a second to be able to say, I see the complexity that the resident has in terms of workload and pressures themselves. I see the complexity of having to deal with patients because they are the center of our patient care. But being able to see the patterns of relationships and processes so that when I can identify that, I can maybe find my fit and my value. I think for the student perspective, identifying and understanding what is it that they can learn. And I think, because we're in an educational environment, for students, when they're in the classroom, they have learning objectives. They have, a clearly stated learning objectives are the first step in a class. What are those learning objectives for the clinical space? And because oftentimes I hear students saying, well, they want to be able to observe surgeries, or they want to be able to observe and do things, but maybe perhaps first they need to show their knowledge in another way. So I guess, Genevieve, if I could ask you a question, how do you see it, as I've described at least the situation from a medical student perspective, how do you see it from a nursing student perspective?
So I think it's similar. I think there's just a lot of competing demands of nursing students when they're in the clinical space. And I think often nurse educators and preceptors on the floor have challenges with not trying to just orient them to the floor as much as just teaching them to think like a nurse. And so I think people often get caught up in being too skills focused or task focused, whereas because that's what the day-to-day work requires, but instead trying to focus more on transferable skills. I think that's something as educators we're always trying to work on. The other piece that I think is really interesting is how nurses transition into practice and have to immediately go from being in that student role to being a leader very shortly. Their orientation is 3 months, which is a lot shorter than probably residents get. And so that I think is a tough transition to go from student to hitting the ground running.
Right. Well, and I think so that one thing that I have heard is, and I wonder, well, so I've heard students, third-year medical students or fourth-year medical students say, I can't believe, like I now interact with second-year medical students or third-year medical students as a fourth year, and I can't believe how little they know and how much I know. And I do wonder if there is a way of, and they also talk about how they've developed their sense of how they talk to patients, how they build, and how they found their way, their method of talking to patients and interacting with patients. And kind of to your point of building these transferable skills, can medical students and nursing students, the framing of what they're gaining in the clinical space be that, thinking about this as a safe space where you can start observing those that are in the role that you will be in, but also practicing how you build the skills of patient interaction or even colleague interaction, and kind of those, like you said, transferable skills that then will be more valuable to them as they take on that leadership role. So I think the other thing is about, learning to maintain equilibrium and resilience, and specifically in solving complex problems, whether it's in healthcare, whether it's in business, environment, social justice. We're building, it's important to build those practices now. So kind of, building off of what I was just saying, like having these students build off of things and develop their processes and build their practices for self-reflection and mindfulness now, so that they start building better habits. And, I'll use myself as an example. If I could have built those skills and strategies as a graduate student, I think that my first few years as a faculty member might not have been as stressful. And practicing communication. And communication, while it is often attributed to the success and or failure of teams, it is just one aspect, but it is very important. I think understanding that for effective communication to occur, there are many underlying factors that need to also be in place, that need to be the foundation. So that issue of trust, if you're thinking about from the student's perspective, I may not communicate freely or openly because I don't know that I trust the resident or the attending to not judge me poorly and not mark me negatively in terms of my evaluations. But communication and understanding and evolving that language of communication and ability to build that skill in the workplace. But then also, I guess from the student perspective, developing these skills as students now, because this is an environment where, even faculty and students can learn and grow professionally. I think some of these are some of the things that can be done. All right, I know we have about 10 minutes. So a little bit about communication. The last 2 slides that I have are all about communication. So if good communication is common sense, then why isn't it more common? The more and more we are attached to our technology, the more and more I think our society is failing at aspects of communication. In the age of social media, it's really hard to really kind of pin down what good communication is. We have communication through different modes, and understanding kind of where what the most effective mode of communication is imperative to kind of understanding how we're communicating in the workplace. I think part of this aspect of mode can be also layered. Something else that can be layered on that is this issue of stress and or tension within the workplace. So whether it's patient care and having just not enough resources, definitely has influence on communication. So effective communication isn't just the transmission of it. There is a pattern to it. So an exchange of information, and it can take place in a variety of modalities. So we think about the way we communicate with people on a daily basis. We send email, we send text messages, phone calls, face-to-face, and also nonverbal cues. That's one of the difficulties. I don't know if you have all seen much of the recent research about how being on Zoom is actually more taxing and more exhausting than being in day-long meetings, is because we sometimes don't get those nonverbal cues because people may not be on camera. We can see ourselves, so we're seeing ourselves in this conversation, which again is taxing to ourselves. But the point is we have numerous modes of communication, and it has its advantages and disadvantages. In the healthcare system, I think understanding how technology plays, the EMR plays in this communication amongst teams and amongst people working together, I think is crucial. So I think considering effective workplace communication and framing it in terms of thinking about the modality, the timing, the tone, the framing, and the feedback are important to effectively communicate. So there is a huge difference between listening and actually waiting to make your point. Arguably the most important of these communication skills is active listening. It's being active and not passive, closely paying attention to what others are saying, to understanding emotion, understanding any questions that you might need for clarification. Having this, we've talked about communication skills, but having this social perceptiveness, understanding how people are reacting, or whether it's in line with what you expected them to react to a message, but also self-monitoring and having sent if you send a message late, as in terms of a text message to a coworker, understanding kind of what that might mean in terms of that messaging. So these are some of the workplace communication skills that I think all of us here, students, others, can really practice, and maybe even start to unpack that communication onion and say, well, what aspect of communication is failing? Is it that we're not providing enough opportunity for active listening, or are we not engaging in social perceptiveness because because our time, the time limits on our work is so stretched and so stressed.